The Subcommittee on Health of the Senate Finance Committee will come to order. I first want to thank Senator Wyden and Senator Crapo for their help in allowing us to move forward with this hearing today in regards to transplants. I also want to acknowledge Senator Young, not only for his taking on the responsibilities for this hearing, but also his leadership on this issue. And we thank Senator Daines for his cooperation in allowing the subcommittee to proceed with today's hearing. And lastly, I want to thank Senator Grassley, who has been the real champion on this issue for many, many years. He will be joining us. He's at the Judiciary Committee right now, and he will be joining us shortly, and at that time he will be recognized for his opening statements. In the United States, the need for organs is far greater than those available. There are about 104,000 adults and children on the national transplant wait list, and every 10 minutes another person is added to it. In 2020, the Senate Committee on Finance did an investigation into the system and documented significant failures. Today, we discuss the path forward to a better system. My constituents in Maryland have access to 2 excellent transplant centers in our state. Maryland also has a Tier 1 organ procurement organization, OPO, that is taking innovative action in some of the most underserved areas like Baltimore City to encourage organ donation. This OPO has been among the top 10 performers nationwide. Access to transplant in Maryland is far from perfect. Despite the high-performance transplant ecosystem, due to the major underlying issues with the current transplant network, 148 people died while on transplant waiting lists in Maryland last year. That's unacceptable. Other states are not so lucky. Marylanders and people across the nation deserve better. Nationally, 17 people die each day waiting for an organ transplant. OPOs are ranked Tier 1, Tier 2, Tier 3, depending on performance levels, Tier 3 being the lowest. According to the Center for Medicare and Medicaid Services in 2023 performance review, 24 OPOs, or 42%, have been classified in Tier 3. Senator Wyden, Grassley, and Young and I have been leading the Senate Finance Committee's investigation into the organ transplant system for over 3 years. And each new line of inquiry has exposed more and more failures, which are often borne by the sickest patients in the nation. Specifically, our committee has uncovered transportation and testing failures that have put patients' lives at risk, outdated information technology underlining the network, a lack of oversight by the current Organ Procurement and Transplantation Network, OPTN, contractors, the United Network of Organ Sharing, UNOS, and misuse of Medicare funds. These disparities impact people throughout the country, including those who are low income, the uninsured, members of racial and ethnic minorities, people with disabilities, and rural populations. Even more concerning, the U.S. Digital Service has found that UNOS is incapable of modernizing the OPTN IT infrastructure. The stakes of neglecting the needs of the underserved community could not be higher. During the last administration, CMS put out an OPO final rule which will establish a performance tiering system that triggers decertification, competition, and potential DSA reassignment. HRSA has taken critical steps to modernize the OPTN, but statutory changes are necessary to ensure that HRSA is able to work with the better-equipped organizations to ensure the OPTNs is operating in an efficient and safe manner. When lives are at stake, Congress cannot accept logistics or poor administration as excuses. Last week, we held a roundtable with senior officials from the Center of Medicare and Medicaid Services and HRSA. It was a productive conversation where we discussed efforts to modernize the organ transplant system and increase transparency and accountability. Currently, we have a system that works well for some, as some of our witnesses will discuss today, but that is insufficient. Where an individual lives or their ability to afford travel to get care should not determine access to life-saving organs. Today, we have the opportunity to hear from patients and professionals who are working on key reforms. Our committee will continue to address the biggest challenges facing our nation, including the transplant system. We demand better, and will not stop until we make it so. With that, let me recognize Senator Young.
Thank you, Chairman